Good afternoon, ladies and gentlemen. Welcome to today's Healthcare World Series event. I hope there wasn't a crossover there from my pre-panel debate to the event itself. But yeah, you're all very welcome, and it's good to see you all. Today, my name is Steve Gardner. I'm the Managing Director of Healthcare World. And today we're going to be talking again about opportunities in Saudi Arabia, which, as those who follow our events regularly will know, I consider to be probably the most exciting opportunity in global healthcare at the moment, and certainly somewhere that international eyes are very focused. Today, particularly, we're going to be talking about a big event that will be going on in Saudi from the 9th to the 11th of October in Riyadh, Global Health, where Healthcare World are media partners, where you will be able to pick up copies of our latest edition. We're going to talk about that event. We're going to talk about opportunities in Saudi generally, and to help me with that, I have, as always, got an absolutely fantastic panel. So in no particular order, we have Dr. Ahmed Messiah, the Deputy CEO of the Eastern Cluster, who's going to talk about the healthcare transformation in Saudi and what the opportunities look like. We have Mr. Sabri from Davita, one of the exhibitors at the show, who will tell us all about what he hopes to get from the event, as will Ida Yousafi from leading digital health company Huma, who will be out in Saudi for the duration. We're joined by two European governments that have interest in Saudi Arabia, in Aya Matouk from the British Embassy in Riyadh, who was leading a trade mission of UK companies to global health, and Bjorn Alma from Skanacare, part of the Swedish government, working with the teaching hospitals of Sweden to help provide advice and guidance to the Saudi clusters and Saudi providers. Isabella Rango from Mott MacDonald, who will be familiar to many of you who've watched our events in the past as being a leading expert and a really insightful individual when it comes to talking about opportunities in the Middle East, is also with us. But first, I want to come to Mohammed Sabri. Now, Mohammed is the event director for Global Health. He is organising and leading the organisers of the event that will be taking place from the 9th to the 11th of October in Riyadh. And Mohammed, I wonder if you could start by giving us a bit of an overview of Global Health. What is it? What's its history? Who will be attending? Tell us all about the event, if you would.
Sure. Thank you, Steve, for organizing this panel discussion, and thank you for the introduction. Good afternoon, everyone. My name is Mohammed Sabri. I am the exhibition director for Global Health exhibition in Riyadh from the 9th to the 11th of October. Global Health was initially launched in 2018 for its first edition, followed by 2019, and then obviously due to the pandemic, all events were suspended. We are now back for our third edition and biggest edition. We are organizing Global Health in partnership with the Ministry of Health in Saudi Arabia. They are our patrons and our partners, full supporters. Everything we do for Global Health is in coordination and partnership with the Ministry of Health. Global Health, as I had mentioned, is in its third biggest edition. The opportunity is for international and local Saudi companies to be present and showcase their various products and services, whether they are in the medical equipment, imaging and diagnostics, healthcare providers, governments, laboratories, for those companies to be present and, as I said, showcase their products and services to the wide range of visitors and buyers who will be attending, from distributors to manufacturers to hospitals, and basically to do business. The main objective, obviously, is to highlight the strength and resilience and growth opportunities in the healthcare sector in Saudi Arabia, to allow for our exhibitors to meet with local Saudi stakeholders, government, obviously the Ministry of Health, and hopefully to come out of this with big partnerships, big discussions about how international players can support and assist and be present in the path of the Ministry of Health's vision and objectives to become a major healthcare hub and sector in the world, not only in the Middle East. We have major companies, international companies, such as the Vita, who is our sponsor and primary partner in this venture. But of course, we also have Philips and Siemens, 3M. We have laboratory companies. We have Roche, Abbott, Randox, laboratory section on its own, obviously. And then we have local companies, Sulaiman Habib, different healthcare providers, and manufacturers and distributors. In parallel to our exhibition, we have a very exclusive leaders forum. Basically, this forum aims to enable essential dialogue between thought leaders and government officials on service delivery, on main topics such as service delivery, driving the digitalization of healthcare, access to medicine and technologies, health system financing, and leadership and governance. It is a forum to address key aspects of the healthcare ecosystem engaged in the delivery of the National Health Sector Transformation Program in Saudi Arabia and Vision 2030. The topics, as I mentioned, will highlight, will present access to healthcare, future healthcare service delivery, health system financing, health economics, digitalization of healthcare, and leadership and governance. On the last day of the show, we will have Innovate Talks, which is a startup pitch competition to allow for startups to showcase their latest innovations and technologies, and to allow for a panel of judges to assess and hopefully grant the competition to one startup at the end and give them an award. And finally, we are going to have several tracks, CME tracks, which are, as you may know, technical topics covering things like future of lab, public health, quality in healthcare, and finally, radiology 2.0. So in a nutshell, this is what global health is about. We are very optimistic. Everyone is very enthusiastic and optimistic. We are getting a lot of interest. As you have said, we have governments such as the United Kingdom, Sweden, the United States, France, Germany. They're all interested in this exhibition. They are going to be at present through their diplomatic and commercial missions to obviously meet with exhibitors and also to look at next year and discuss strategies as to how we can involve these different governments and companies from those different governments and countries to be more involved and more present.
Thanks, Mohammed. For those watching, by the way, if you're watching on our website, you'll see there's a big red button right underneath the screen where the speakers are talking. Obviously, the opportunity to click and ask a question. And I mention this particularly because somebody has already pressed that button and asked probably the most obvious question, Mohammed, which is, how do I register for global health? Do you want to just give us a quick instruction on how people can register and get involved in the event?
Of course. You can go on to our website, globalhealthsaudi.com, where you can register as a visitor. You can either just visit as a visitor, or you can register to one of our conferences. Our marketing team will go through the profiles and everything. You're able to access our exhibition, and depending on your profile, your expertise, you may be also able to attend the CME based on that profile. So go to our website. You can register as a visitor or as an exhibitor. We are still we have very, very small stands available, but do contact us very soon because we are running out of space. We are almost sold out. So through our website would be the easiest channel. Once you sign up, we will get your information and we will contact you immediately.
And if you are registering to come along, I believe it's free to attend, is it not, Mohammed?
Yes, it's free to attend, of course.
Free to attend. So please do come along. I think it'll be a fantastic event, and make sure you visit the Healthcare World stand when you do. Thanks. So, Mohammed,
sorry, if I may, just to add one point. It is going to be a very busy and successful event. We are at this moment we're expecting more than 10,000.
Fantastic.
More than 10,000 professionals from the industry coming in as buyers. More. So,
what sort of people are you expecting? What's the kind of profile of visitors?
Obviously, we get a wide range. We could get from key decision makers, C-suite, managing directors, procurement, purchasing managers and directors, from various healthcare providers, distributors, dealers, and end users, doctors, nurses, anyone who actually utilizes the products in their hospitals and clinics. So it is going to be a very professional B2B event, and we do always target people within the industry through our marketing campaigns to ensure that when you do attend, you are within that sector and you do have some valuable conversations. So hopefully we're getting closer to that 15,000 mark, and we're expecting to exceed that in terms of visitors. In terms of exhibitors, we're currently at more than 150 exhibitors.
So it is a key event. It's been an important event in the healthcare calendar of the Middle East for a few years now. But, and I think this is where it gets far more important, it becomes particularly prescient given the transformation of public healthcare in Saudi Arabia. Because at the end of the day, one of the big reasons certainly that Healthcare World is getting involved in this event, and I think many, when we speak to the governments and to the exhibitors that are taking part, that one of the reasons why is because of that transformation of public healthcare. So in order to get a bit of an insight into what that transformation looks like, I'd like to bring in Dr. Ahmed Al-Masayed from the Eastern Health Cluster. Dr. Ahmed, I wonder if you could give us a little bit of an overview of how the structure of Saudi healthcare, Saudi public healthcare is changing and the role that you as clusters are playing in that.
Thank you, Steve. Good afternoon, everyone. I'm delighted to be here with this fantastic panelist and to be here with the audience. It's a great pleasure actually to talk about the Global Health Exhibition in Riyadh with the fantastic preparation and work has been done over the past few years. Myself, I co-chaired the previous version of Global Health in 2016 prior to this version. It's been a great venue all the time where the kingdom is presenting its healthcare transformation led by a wonderful organizer, Informa. And there's been a lot of showcases of discussions and companies and development and advancement of healthcare delivery and technology. Today, there is as everyone knows, there is a vast development and transformation going on in all aspects in the Kingdom of Saudi Arabia, and most importantly in the healthcare industry. Not only in the regulator side, and the provider side, and the payer side, from engaging the private sector, engaging the third sector, engaging the international community, and moving on from the traditional way of delivering, business of care into more advanced, transformed, outcome-based, value-based, focusing on talent, focusing on technology, on digital transformation, as well as focusing on partnerships. All these basically, we can say that has been embedded into the Global Health Exhibition and various other venues for discussions in the country in the coming months. On the regulatory side, there has been a lot of discussion right now at the Ministry of Health for transformation to become the most regulation in the country. There is the development of the payer business through the Center for National Health Insurance, as well as the evolvement of the Center for Commercial Health Insurance as well from both sides, for the government side, not for profit, as well as for a private side. In terms of the healthcare delivery, the Ministry of Health has more than 220 hospitals and around 2,500 primary care centers all across the country. Right now, the transformation journey has been to go with not with the privatization and say, but more of a corporatization, and with the recent royal decree of the creation of a health holding company to develop the government owned state company, not for profit, and creation of clusters or network of providers across the country. More than 20 clusters going to evolve. This is basically going to really reform and reshape the way we practice the delivery, the way we practice medicine, the way we envision integration and a relationship between primary care center and medical cities and hospitals. The way we look into digital, not just simply as an enabler, but also to transform the way we practice medicine to become much more digital, reliance on digital, to transform not only to digitize or digitalize, but also to transform the way we practice medicine into more digital, connecting patient to providers and connecting providers to providers most importantly. In terms of data, right now we used to be on the area of patient data, but right now we are moving beyond the boundaries of facilities, moving to the area of population health data. How are we going to have reliable sources of information on all population, not only patient, including the more risky one, as well as the healthy people to stay healthy. So we want to have more data as much as possible about our population to design care management for them, as well as to reform the model of care and the design of care that we are having. Definitely, we have a large assets of people and also of facilities, but definitely we are seeking more of operational partnerships going forward into the future to operate our facility, to operate our function, as well as to have real sense of capital investment, especially to revive the current existing facility, as well as look into the gaps and the area that we need to have as a capital investment in the future. I hope in a nutshell, I put this picture of transformation in the countries going on. It's more than this. I just tried to summarize it. There is a lot going on right now. The Eastern Health Cluster has been, participated in so many activities today and been leading the show and most of the research and development activity right now in the area of health delivery, business development, and transformation. We are testing a lot. We are accepting that. We are moving, a couple of steps here and moving one steps there. But there is a lot being going on right now in the Eastern Province. And we look forward to participate in the Global Health Exhibition in Riyadh next month.
Thank you so much for that, Dr. Ahmed. That is a fantastic overview of what's going on in the public health system and the transformation of Saudi Arabia. And as you can probably gather from Dr. Ahmed, what Dr. Ahmed just said, there is a hell of a lot going on in this market at the moment in terms of the development of the clusters, the development of the payer system, and the development of the delivery system through the health holding company and the clusters themselves. And that's probably why overseas governments are becoming really interested in the opportunity that Saudi Arabia offers. And from that point of view, I want to come to Ayamatuk from the British Embassy in Riyadh. You guys are leading a trade mission of British companies to global health. You're also going to be visiting Dr. Ahmed in the Eastern Cluster during the course of the week that you're out in the Kingdom. I wonder if you could give us an overview of kind of what you see as the opportunity for UK organisations in Saudi Arabia and what you hope to get out of visiting global health and visiting the Kingdom.
Thank you so much, Steve. I think you can hear me well, right?
Yeah, coming through perfectly.
I can see some nods. So thank you again for organizing such an interesting panel discussion and to highlight such an important exhibition. Just to reintroduce myself, so I lead the healthcare sector at the Department for International Trade at the British Embassy. Our main job at the department is to liaise between UK companies and the Saudi healthcare sector to make sure that we're generating trade opportunities for the UK companies who are looking to expand internationally. We do have string links within the government, whether it was the Ministry of Health or other ministries such as the National Guard or Ministry of Interior, and as well with the private sector. So this year, we're definitely expecting this Global Health Exhibition to be very well attended. And as you have heard, there's a special interest from the Ministry of Health to make it more success than ever. It's definitely the first exhibition after COVID, and they want to make sure they are coming back strong. And I think it's not only the UK government, it's definitely other government who's also paying attention to it. So for the activities that we're organizing around it, so we're not only taking a stand in the exhibition itself, we are also organizing a full trade mission between us and Healthcare World. We have over 26 entities visiting the kingdom that week officially with us, in addition to other UK companies who are visiting the kingdom that week, but arranging their own program. So the level of attention and interest is quite high. And being someone who's close to the senior stakeholders, we definitely felt how much important they feel this year exhibition is, and the attention that they're giving it this year is definitely more than before. And this is why exactly we pushed, that pushed us to organize a whole trade mission around the same timing of the exhibition itself. And to be honest, this is not the first trade mission that we bring to the Global Health Exhibition. So Dr. Ahmed, you were speaking that you were kind of looking after the first one. We actually brought a first trade mission to the last one, which happened pre-COVID, and that we felt like there's a huge interest and a huge benefit of attending the exhibition itself. So companies who are really looking at international opportunities and looking to speak to Saudi stakeholders, if you guys are expert in healthcare in every area, definitely this is the place to be. So you will not only have the chance to attend the exhibition itself and network with the Saudi stakeholder who are either exhibiting or attending, but you will also have the chance to meet with the main government and the private stakeholders in the kingdom. We're aware that interesting seminars are being also organized and planned. This also will give the companies the chance to get more briefed about the transformation plan and the upcoming opportunity, whether it was from the Ministry of Health or the private sector. Of course, we have other teams who will also brief companies on the market itself, on how to do business in the kingdom, such as MISA. It definitely expand the company's knowledge of overseas buyer network, which is across the kingdom. As you can see, it will not be attended only by the Riyadh stakeholders, but it will also have huge interest from the Jeddah and the Western province as well. So you will also have the chance to identify new business leads and test the market appetites for your service. So I'm actually kind of targeting the companies who work overseas and kind of looking at the exhibition as an opportunity to attend. We're also organizing an evening reception. It's expected to be attended by over 100 guests. It's actually taking place at the first day of at the evening of the first day of the exhibition at the British Embassy. So please do reach out if you're interested to attend that. It will be definitely well attended, and it will have kind of the main healthcare sector stakeholders at that reception. Other than that, as Steve mentioned, we're organizing a full program between 3 provinces, so to make sure that all kind of the entities have the chance to meet and discover their offer within the buyer in the kingdom. Just I think one really main point to mention here, it's now more than ever the time really to engage and work within the kingdom. The transformation that is happening, we can see how much it developed, and we can tell like the companies really clear and straightforward how important that transformation is, and how much the Ministry of Health and other ministry is investing to make sure that the healthcare services is really stepping up into a really kind of developed area. I think that's it, Steve, from my side, and for the Global Health Exhibition and what we're doing around it. And we're happy to for entities who have interest in either joining our receptions or joining our activities to reach out to us directly to get more information on that, and even on the market itself and our own kind of way of looking into it. Back to you, Steve.
Yeah, I think it's an interesting one. I think in terms of the opportunities and the offerings that UK government can bring to Saudi Arabia, there's a lot to be said, I think, around the transformation programme, the way in which the clusters are developing, the way in which essentially this is certainly in the early stages of free at the point of delivery health system. That means that the UK's National Health Service probably has a lot to offer in terms of giving some advice, some guidance, and even some guidance on some of the things that have gone right as well as some of the things that have gone wrong in the UK. So I think the UK involvement in Saudi Arabia will be a strong one. And I guess if we've got Saudi organisations, Saudi public sector organisations watching, they can reach out to you at the British Embassy, can they, if they're interested in engaging with UK companies?
Yes, please do. So if you can, Steve, share with everyone participating our contact details, and we're happy to kind of host them and explore how we can put them in front of our UK expertise. The reason why we kind of do that at the Department for National Trade is to make sure that we don't waste anyone's time. So we know exactly what the transformation is all about, and we understand the requires and the demands in the market. So we make sure that when we bring an international expertise or a company or even a government entity from the UK, we make sure that it's not only their services actually fit into the transformation requirements, but they also understand how doing business in the kingdom is quite different from their own countries. So it's kind of really not easy kind of to bridge the gap between the differences between doing kind of trade between two countries, and that's why we're here. So anyone who's listening to us today and is keen to get in touch and understand more about what we're doing and who are the expertise that we're bringing during that week, please let us know and put our contact detail over there.
Yeah, I think we've got about 1,000 people actually watching the live stream through our website at the moment. Unfortunately, there isn't a facility to be able to send a sort of text or an email to all of them. So, where would they find? Can they find your contact details on the embassy website?
Yes, so if you can email all the participants with my contact detail, or you can find me on LinkedIn. It's the same kind of spelling.
LinkedIn, there you go. LinkedIn's the perfect route. So I am a Duke on LinkedIn is the way to link yourself to the UK government. So that's the UK involvement. Bjorn Elmer from Skanacare, you're attending Global Health. From the Swedish government's point of view, what are you hoping to get out of going to Global Health, and what do you think the Swedish offering is to the Saudi health economy?
Thanks, Steve. We are really excited. Sweden has been working with Saudi for many years, since the 80s. Initially, more traditional collaborations in terms of international patient referrals and training of specialist doctors. Way back before the 80s, my father's a doctor, and he was working in Dammam, actually. So I lived in Al Khobar for a year. And it's amazing to see the transformation happening now. I've been with Skanacare, which is the export entity for the Swedish public healthcare provider, for 5 years almost, and we have an MOU between Sweden and Saudi within healthcare, and we also have a memorandum with the Ministry of Health, between Skanacare and the Ministry of Health. So before the pandemic, we had a number of consultants stationed at the health holding company, working on strategic level with the vice presidents in areas such as finance, model of care, e-health, communication, and management leadership training. For us, it's so exciting to be part of this, and you can see every time you visit how things are developing throughout the Saudi society, and especially now in healthcare with the actual transfer of ownership of the healthcare to the health holding company, which is 6 weeks ago or something. So what before was a bit theoretical. I mean, everybody was very ambitious, but since it was not actually live, it was still a bit theoretical, although the clusters were working very hard on a day-to-day basis, of course. But now things are moving so fast. So for Sweden, and it's quite, this is the first time we are together with the British team here. And it's good to see a joint European effort here. You see a lot of American private consultancy firms, and it's from Europe. It's mainly Sweden and the NHS that you see in Saudi, and we pride ourselves, since both NHS and ourselves are healthcare providers on a daily basis. We pride ourselves very much on the hands-on advice, and as like you mentioned, Steve, on learning and sharing from the mistakes we've made, because making mistakes in healthcare, it takes time to correct them, and they are extremely expensive. So for us, we get a lot of stimuli from all these fantastic. This must be the most ambitious transformation ever done in any country. So for us, we are learning as we go along, and we are sharing what we can from our experiences.
No, that's really helpful, Bjorn. Thank you for that insight. So that's looking at Saudi and what opportunities in Saudi look like from a governmental perspective, from a healthcare system perspective, from the UK and from Sweden. I want now to kind of move on and think about what this means for individual organisations and individual companies. And to do that, Mr. Sabri from Davita, you're very heavily involved in the global health event. Give us your perspective. What are you hoping to get out of both the event, and what kind of opportunities do you see in the kingdom going forward?
Of course, Steve, thanks for giving us the opportunity to share some information for the audience. But before I begin, let me congratulate the Kingdom on its 92nd birthday. The National Day is tomorrow, and I wish the Kingdom a prosperous future. I want to say for us as Davita, we have been in the Kingdom for the last 8 years. I want to say we have lived the pre-transformation, during the transformation, and post the transformation. We've built extensive experiences with the government, and honestly, we're so proud of the partnership, because you know, if you were to use the child analogy, and we were the poster child back then of a public-private partnership. Now this child is growing up. We're expanding our portfolio from not only providing dialysis services, but also to look at the renal care from end to end. We're doing pilots with the clusters, whether it's on the screening and prevention programs, whether it's on the home business and how we can grow that home business for the ESRD patients, the concept of one-bed hospital for ESRD patients, and the portfolio expands and continue to expand. I would encourage everyone listening to this, or is kind of contemplating whether they should attend or not, come in. And I'll tell you why. You will have solid ground for innovation, whether it's technology or healthcare delivery. The other thing, you have great talent in the Kingdom, and there is great opportunities to build that opportunity for the Kingdom and for you as a company. I'll give you one example of what we've done, where we have taken, you know, the pitfalls from one market to another, and how we put that into action in the Kingdom. We're doing this kidney care program, a pilot, where we're doing screening and CKD management. We've gathered our CMOs from the US, from UK, from Colombia, Brazil, and Germany. And they all came in and they put a program. That's combined with our local CMO, and then with the talent and know-how of the MOH, then we came up with a program that we're planning to run here in October. I would say that it's a ground for innovation on new levels for companies to come in and change the healthcare and take it back to your other countries where you operate. So that's what we're looking to share with the attendees in October. We have our C-suite from the US, our C-suite from our international, which is based in London, is coming in. We're all in at the Saudi market. We see great opportunities and look at great future.
Thanks, Sabri. I think that's a really good overview of kind of what you're looking to achieve as a player who was already sitting in the marketplace, who's been established in the marketplace for some time. Ida, I want to come to you. Humour, I've worked with you guys for quite some time now. Fantastic digital offering, but quite new to the Saudi market, aren't you? What are you looking to achieve? How are you hoping to achieve that kind of market entry through coming to Global Health and also being part of the trade mission with the UK government?
Thanks, Steve, and thank you very much for inviting me to speak as part of this very important panel today in preparation for Global Health. I look very much forward to meeting many of you on the call and many more, 10,000 other delegates at the actual event. I am a clinician. I was brought up through the NHS, walking the wards and treating the patients within the UK. But my background and my studies is from Southern Africa and South Africa. And so bringing some of the knowledge of how health system works in different environments into the UK systems, moving into private sector, and then managing and running hospitals for a period of time took me to digital health, where I am now in human therapeutics. And I think that Saudi is a very interesting and exciting place to be right now. As Aya said, there's a very ambitious healthcare transformation program underway. And I believe that the Kingdom of Saudi Arabia is very well placed to successfully achieve this mission. I don't think that any one company has the solutions for all things that need to be done in a healthcare transformation. And as Dr. Ahmed said earlier, partnership is key to making any of this happen. I do, however, believe that if we are able to, as Sabri just said, share our knowledge across the different industries, the good and the bad, as you said earlier, Steve, we'll be able to showcase some real benefits. And one of the key reasons why we are in the region very recently in our partnership with Tamar Group is to be able to bring our hospital at home solution, our virtual ward, virtual care solution, in particular in the cardiometabolic environment, which is some of the largest pain points for KSA, to the Kingdom of Saudi Arabia. Now, that it doesn't stop there. Of course, Humour, we are the bridge between care and research, and decentralized clinical trials and learning and using software as the medical device to try and enable some of these transformations is key. And so we hope to land and then potentially understand better what are those challenges and how we can address them or help address them. Now, some of these are shared across whichever area you are in. One of the key ones is how do we become a lot more proactive and preventative in care, as opposed to the reactive version of care that we all provide today and which is necessary, but we're reaching a stage where the demand is becoming larger than the supply. How can we augment or complement the workforce through, as Dr. Ahmed mentioned earlier, connectivity between partner to partner, doctor to doctor, specialist center to other specialist center, but most importantly, with the patient at the center of it all. So how do we enable and empower patients and people to be able to be proactively part of their wellness and their health? And that is where I think some of this key opportunity for some digital solutions coming in to create these opportunities for change within this health transformation are key. Now, in healthcare, you all know very well that it's a hugely regulated environment. So it's very important to be able to be present in region through all the data sovereignty and regulatory requirements that are required. As a global company, we have some experience of how that looks in the United Kingdom, how that looks across Germany, what that looks like in the US, and some experience in the Middle East too. But you still need to take it to that next level, because the maturity of each area, in the case of KSA, each cluster is very specific to their own cluster, and some of them are way ahead and hugely advanced, especially in the Eastern cluster under Dr. Ahmed's leadership, way more advanced than perhaps some others. And so therefore, when you're addressing those others, you can't apply the same solution to them. And so what I'm really excited about, and for all other exhibitors and people that are coming to the conference, is to actually meet the teams that are on the ground, faced with these challenges every day and start to find ways that we could bespokely try to help those challenges and move them along that pathway so that they can move in this evolution as opposed to revolution of health transformation. Even though it's moving at such a pace, it needs to still be done in such a way that we don't repeat those same mistakes that have occurred in other areas, and bring those experiences to the table.
I think the point that you make, probably the most important thing, is this point about face-to-face interaction, isn't it? Because if you think about the last few years, we've been so lacking in the opportunity to meet people face-to-face, to look one another in the eye and have that kind of level of human contact. And I think probably in healthcare, more than in any other sector in the world, that face-to-face, human-to-human contact piece is really, really important. And I think that's one thing that we're all really looking forward to. Certainly everybody that's been involved in this conversation this morning, I'm looking forward to actually seeing you all in person in Riyadh in a month or so's time. Nobody more, of course, than you, Isabel. We've worked together before. I know you to be an incredibly knowledgeable individual when it comes to working across Saudi Arabia in the Middle East. I mean, from your point of view, what are Mark McDonald, what are you looking to do as an organisation in Saudi Arabia and looking to achieve from these kind of events? And how do you, as somebody with a bit more experience already of working in the region, how do you think people can get the best out of these kind of events?
Thank you, Steve. Well, as you know, Mott McDonald's is a key priority. Saudi is a key priority for us in the region, and we do already have offices in Riyadh. It's important to note that the transformation also affects the private sector, and we have had the fortune to be on the Ministry of Health side as well as private investors as technical advisors to public-private partnerships as well. As was stated many times, the transformation has created vast opportunities, in the entire healthcare system, the whole ecosystem, in the hospitals and outside the hospitals, both in services and products, particularly as it relates right now to subject matter experts, which we at Mott have many private experts. But I think it's important to know that the opportunities for collaboration, as was mentioned, also is immense within the Saudi. There is no one company that can possibly do it all. And I think forming collaborations, forming partnerships with various entities that maybe you have a gap in some services, but they can offer, the services in another realm. I think that's important also. So what we would like to get out of it, besides high-profile speakers, which are excellent, by the way. I've attended the exhibition on other occasions, and the quality of speakers are tremendous, as well as new innovative products that we might be able to add to or actually just get the knowledge of. So we're hoping to meet entrepreneurs from all over the world that are interested in our services, collaboration efforts as well. For me personally, it's a very exciting time. As you mentioned, I'm dating myself, but I've been in healthcare over 30 years, and I've got to tell you, this transformation is extremely exciting to all of us in the healthcare. And the move towards the non-hospital centric is very interesting to all the sectors, because we're taking a look for the first time at the entire ecosystem and changing the model of care, which in and of itself creates many, many opportunities on all the sectors. So we're hoping to see, familiar faces, new faces, people that are interested in the private sector as well as the public sector in our services and all that we offer in the region.
Thanks, Isabel. So there's a number of viewpoints there about Saudi Arabia, about what the opportunities look like, and about how we could best use an event like Global Health to bring people together. Partnership is a theme that keeps coming out time and time again in terms of how we can work together to kind of deliver better healthcare in Saudi. I want to come back to Dr. Ahmed on this point, because I know that from the point of view of the cluster, your partnership is very much what you guys are about. It's looking to find international knowledge, guidance, and partnership from around the world. What particular areas are you interested in looking at partners from? What are the kind of key concerns and the key areas of priority for the Eastern Cluster?
Well, I believe that we have so many successful partnerships in the past. One of them is the Vita one that already right now delivering actual care in partnership with the Ministry of Health for a number of years. This is one of the key successful reference kind of relationship that we always refer to in order for us to develop a sense of how does partnership would look like. But looking into the current dynamics of the activities going on, the transformation of the country, there are so many partnerships we are calling for. Number one, definitely on the most traditional way of delivering care, of actual care through primary care centers, through secondary hospitals and medical cities, being it on the medical services or in the laboratories or in the imaging or in the pharmacies, etc., or patient services and social services, etc. There are so many opportunities today with regard to partnership, where to go for, but also on the transformational sense of developments today. Definitely, there are a number of experience and wealth of knowledge has been happening from various parts of the world. Whether be it at the NHS in UK, in Europe, at Secuna Care and community health, at the US, in Australia, for example, in remote healthcare, in South Africa, for example, in primary care, and the list is on and on and on. And where we want partnership to transfer wealth of knowledge and experience to transform, and for us, for our team, and for our people to do better into population health management, community health management, public management, and then certainly on the modalities of traditional medicine. There are so many investment today on the model of care. It's going on right now for the past 4 or 5 years, and it will continue for a longer period of time to transform the way of we practice medicine. We have 6 pathways. Whether it is in palliative medicine, chronic care, blunt care, surgical care, safe birth, and others. So many ways in traditional medicine. And then when we move into the area of digital health and how much that field today and in the future trending is going to bring us opportunities to improve the way we practice medicine and to deliver care to people. There are so many things going on happening right now. Some of them might be expensive and some of them might be practical. So we need to figure out a way of partnership to embed these trends and digital activities into our system. The area of data and how much we can gather data around our population and how much is that going to be helpful for our care management program and redesigning the care that we are having. Stratifying patient and stratifying group of cohorting population would require a massive work into the future. That is basically on the what, but on the how still we need to figure out the right equation, the most beneficial equation that is going to happen between the government and the partner, as well as from the delivery side and the regulatory side and the payer side. There is still a partnership required on the development of the thinking and the business modeling, on the writing the equation that is, I wouldn't say only profitable, but also of beneficiary, of value to both and all parties involved. So many activities has to happen. We need to test, we need to pilot, we need to think, and most importantly, we need to invest into how. We are jumping a lot on the what is going to be the subject of partnership, but also we need to invest on how are we going to develop these partnerships, how can we pilot for them, starting with the small projects and, in order for us to have the sustainable relationship into the future. Pharmaceutical, life sciences, massive area for partnerships. So where we can start is, or what I can say is, two people sitting down with each other, find the right place that is helpful for them, figure the how and figure the what on partnership. But opportunities are huge.
It really is, isn't it? I mean, there are so many opportunities, so many things that need to be achieved. There's almost an element of where do you start. But yeah, I think Dr. Ahmed put it brilliantly. You start off by having a conversation. We've got about 10 minutes left. We're finishing at 1 o'clock UK time. So I just want to have a quick run through the remaining panelists, just to ask each of you, what are you going to be doing with the week that you're at Global Health? What are you looking to achieve? How are you going to go about getting the best out of this event? Start with you, Aya, because I think you've got, how many companies have you got joining you over the week in Saudi?
So far, we have 26 between you and me, Steve. We might be raising the number to 27. We're still don't know. But anyway, it's not only the companies who are coming with us to the trade mission. It's also the companies who are actually letting us know that we're not coming with the trade mission. We're doing our own program. So it's quite an impressive number as well. So at least I have been emailed over like 20 companies who've been coming by themselves during that week to make sure that they don't only attend the exhibition itself, but do have the kind of the face interaction that we're speaking about. And we do kind of push that message a lot. It's a place where you have to have this kind of physical interaction to make sure that you're really understanding the requirement really well. I think two things, it's going to be a full week, Steve. So we're actually moving from Riyadh to Jeddah to Dammam, where kindly we will be hosted by Dr. Ahmed with the delegation. And we are organizing already a couple of evening reception, one of them in Riyadh, one of them in Jeddah. So we'll definitely have our hands full during that week. It's going to be kind of the most busy week of the year for healthcare specifically. But I wanted kind of to press kind of a couple of points that were mentioned before. The capabilities that we're bringing with us from the UK are quite a kind of range from NHS Trust, who are experts in mental health, clinical patient safety, a lot of really interesting areas. But most importantly, I want to press on the fact that digital health and mid-tech is definitely one of kind of the areas that's getting a lot of investment and interest, especially within the clusters. Just to raise the fact that His Excellency himself, the minister, is an IT expert. He's not even a physician. So the two ministers that we had within the Ministry of Health, they were both kind of IT experts for the last 6-7 years. So they understand how data is really important and how much it's beneficial, and it gives you really a flexible solution for both the patient and the physicians. And I think the other point that I had in my mind is as Aida mentioned, it's not a single company who can deliver. We're not speaking about 150-bed hospitals. We're speaking about huge transformation over than 20 clusters. So it's not a single company. So that's why putting expertise within each other, and that's what we kind of support as well with. So not a single company can definitely do that. And we understand that specifically because of the similarities of the two systems. So the similarities between the UK healthcare system and the Saudi system, they're quite similar in the way of structure. So primary care, secondary care, and tertiary care. So the requirements have been kind of a bit similar when you compare them. So we're gonna be quite busy, Steve, during that week, saying that. And please do reach out as we said. Maybe in my LinkedIn or the email contact that Steve will be sharing with you in any way that we can support in forming this partnership or introducing you to new opportunities, one of these ways.
Thanks, Aya. Sabri, how are you going to be spending the week of Global Health and what are you looking to get out of the event?
Sure. So how we plan to spend it is honestly, we do have dedicated sessions on sharing knowledge. We believe that Saudi market is a great market for other companies to come in because one company cannot do everything. So you need more collaboration among companies and building the know-how. Also, I would kindly ask the participants to come in with an open mind. If you have a certain way of doing business in your country, come in with an open mind to bring in the best. It's a solid ground for, as I mentioned, innovation technologically and from a delivery point of view. So we're looking to meet, to collaborate with companies, compete with companies, but the end in mind is to deliver the transformation for the kingdom. As I mentioned, we have our C-suite from both international and the US are coming. So we have 2 speaking slots, day 1 and day 2. We will be sharing the future of how we see renal care in the kingdom. But last but not least is we do have a dedicated session for the doctors and the nurses. Specifically, there is a workshop on day number 1 as well for people to kind of get to know how we look at the technology, how we practice it in the kingdom. But happy to connect with anyone who wants to know more. Would love to share our experience and our great experience in the kingdom.
Thanks so much, Sabri. Bjorn, what are you going to be spending the week at Global Health doing? Who are you looking to meet and what are you looking to get from the week?
Well, the most exciting thing is the people I don't know that I'm going to meet, because there's going to be a lot of new people, and for us that's very interesting. Then I'm going to be going in and out from the Ministry of Health also, and the Health Holding Company, because we have a number of ongoing projects with them. So I will be coming and going, but I will hope to meet all of you guys here and the people watching, and have good, like you said, Steve, it's all about starting a discussion and see if we can help each other.
And Ida, from your point of view, what kind of partnerships, what kind of opportunities do you see for HEMA coming out of this week?
So I'm really excited about meeting all the people I haven't met, as Bjorn said, but also building on the relationships from some of the conversations we've already had and had the luxury of being introduced to already. I'm looking forward to seeing the Eastern Cluster and Dr. Ahmed's team for sure, and all the fantastic work that's happened there, following on from our visit there earlier on in the year. I'm also looking forward to really meeting and understanding better from the Kingdom of Saudi Arabia's experience and requirements, what it is that we can really bring our best hand to. So in the process of then learning knowledge and understanding from one another, doing the homework, I guess, so that you are fully prepared for the test at hand. So we've got solutions that have worked really well, through the National Health Service for virtual wards, which is now being launched nationally here. The other solutions for decentralized clinical trials over the COVID vaccine time to, post-market authorization of trials. And so the interesting partners in life science, and how we can start to companionate through software as a medical device some of these solutions to better scale at speed the requirements of the health transformation. And as I mentioned earlier, I'm also quite interested in understanding some of these risk assessments that are going across, and awareness on some core chronic disease management in the Kingdom of Saudi Arabia, to see how we can start to, perhaps impact some of that preventative and proactive care I spoke about a little earlier. So yeah, really busy, super excited. And those conversations and learnings can only happen, as you said, Steve, face-to-face and round a table to really get to grips with it. And also visualizing the hospitals, the wards, and the nation as a whole, how it's being set up currently into the clusters. I've only had the pleasure of going to 2 of the clusters so far, so I'm really looking to expand my knowledge on that.
Isabel, as somebody with a great deal of experience in the region, for those coming for the first time to Saudi Arabia, those coming to look at this opportunity, what advice would you give to them if they're coming here for the first time, looking at this opportunity for the first time? What should they be thinking about? Well,
definitely they should map out what they want to do, who they want to see, what conferences they want to attend. Have a map of what you want to do and what your priorities are after, and leave yourself a little time to meet new, to have meetings, collaborations. I will be staying probably the whole week. As you know, we're joining the trade mission. Abby, our digital health person, will be with me, as well as Richard Cantley, which is our global head of healthcare. And we plan on introducing our new digital twin at the convention, so as well as meeting with stakeholders. So my advice would be, try to map out the areas that, and have an agenda, the areas and what you want to accomplish, and be very precise on what services you'll offer, as well as the return on those services as much as you can. Sometimes meetings are very quick and sometimes they're very long. So be prepared to offer the short version and the long version. But really, it's exciting opportunity. We'll be going to Riyadh, Jeddah, and Dammam as well. This is the first time we're actually serving as partners to the mission. And we're very excited, myself, Abby, and Richard, to attend.
Thanks, Isabel. And final word to Mohammed. It's your event, Global Health. What advice would you offer to people coming into Global Health to get the best out of the week?
Sure. So from an exhibitor point of view, I always say, come in prepared. Taking a stand is just 70, 80%. Promote your presence at the show weeks before through your various communication channels, LinkedIn, social media. Let people know that you're there. Connect with your potential buyers. Pre-arrange meetings. It happens quite often where exhibitors just come in and expect that visitors are just going to flow in and come to their stand. I think it's important that you do invest as an exhibitor in your communication prior to the show. At least 3 weeks. That's the minimum you should do. From a visitor point of view, as Isabel said, plan, map out your journey, assess, research the exhibitors that are there who will fulfill your requirements. And don't want to add much more. Everyone explained this very well. But yeah, be prepared, communicate, and promote yourself prior to the show.
Thanks, Mohammed. Well, that's about all we've got time for today. All I would say is that if you're coming to Global Health, please reach out to me, reach out to all of our panelists that have been involved in the call today. It's going to be a fantastic event. Look forward to seeing you all in Saudi Arabia and indeed on the next Healthcare World Series session. Thanks very much and goodbye.